Hello, I'm Larry Berkelhammer. I'm very fortunate, as you are, that we have Dr. Erik Peper here, a renowned authority on psychophysiological self-regulation. Welcome.
Well, thank you for having me here.
I've been fascinated by some things that I would like to ask you about, and I think people will be interested in this. I've read a lot about how unconscious, non-deliberate participation in a ritual, such as a visit to Lourdes in France, a visit to a faith healer, a visit to a medicine man, a voodoo master, a faith healer, that these experiences seem to precede a remarkable, unexpected recovery from illness when there's absolutely no medical explanation, no scientific explanation for this. And yet there are documented cases in the thousands of people who've been healed by healers.
You're totally right. Thousands of people have been healed by healers, by going to a place like Lourdes. And whether I like it or not, as a scientist, it has nothing to do with liking, the evidence is there. Data is data. A patient goes with arthritis, with cancer to Lourdes, or goes to a faith healer, or sees Kawakami, or sees Muramatsu, whoever it is, a healer. And for some, not all, for some, a remarkable healing occurs. Mm-hmm. And to me, the question is really, how come? What is going on? Right. Well, you can definitely say it occurs. So that means something happened. It is clear, I think, that people did not regrow limbs. That doesn't seem to happen.
There's no evidence for that.
No. There is superb evidence for almost any disorder which we could say has an immune dysregulational component.
Including cancer.
Because you could say that's a failure of the immune system.
To kill the cancer cells, right.
Yes, or arthritis, where it's too active. Yeah. And what you see is that these patients go there. They don't even have to be a believer. That's the most interesting part. They just go, and something happens. And what that is not really understood. The only thing I can think about is that somehow being there, they felt a sense of trust or safety. Or at that moment, something happened by which their belief structures changed. Or was it more energetic, in which their energy body changed, and all of a sudden their health started to be mobilized? We do know that healing rates vary. Some people can heal very quickly, surprisingly. So possibly if at that moment you have such acceptance, you get caught up so much in this experience without knowing, you don't know you're doing that, then as if the illness falls away.
The acceptance piece reminds me of a lot of people, a lot of experts have said, when you're diagnosed with cancer, the ideal is to have full acceptance for the diagnosis, but not accept the prognosis.
And there's even a stranger piece in that there is data that for a few people who, when the doctor says you have cancer or any illness, they say, I don't believe it. They're in denial. They're total denial.
And they do well.
A very small percentage.
Yes.
I would not want to be the better on it.
The denial people don't do as well as the others, but many of the people with complete denial actually do overcome the cancer.
Let's say some. So when they go to the doctor and they have all the data is there, they basically say, Doc, you don't know what you're talking about. They walk out, they never see the doctor again. 10 years later, they're still alive. They're very rare. Most do in fact, don't do well. But it's intriguing. How can that happen? And to me, that is the essence what research ought to be looking at. We should be looking at these unusual people to look at hints. Right. What is happening with them? What are the factors in the environment? And when I study healers, and I was just in Amman, where I studied Sufis, and where they stuck skewers, this non-sterilized large skewers, through their cheeks, through their tongues, through their pectoralis, hammered, hunting knives in their head. And they just did this. They sat totally peacefully. They did not show any body response of pain. When the skewers were pulled out, the hunting knives was pulled out, there was no bleeding. They went right back to their chanting. And what was the common quality, and I've seen this in many other places, is the absolute trust, you could say, the normalness of this. It's not an abnormal phenomenon at all.
Right.
The total acceptance, and in that state, it seems it's all possible. And I remember about 3 weeks ago when as a man observing this, even I participated and had a skewer put through my cheek. It didn't hurt.
Because you trusted the process.
Whatever. I mean, and if I'm really honest, I could have said, well, to be really honest, I don't totally understand what is going on, even for me, because you could say I wasn't in the ritual. I'm not a believer of them in that same way. Maybe I was doing group hypnosis.
Yeah.
But if I call it that, I don't understand it anymore.
Right.
I just gave it a label so I don't have to think about it. And to me, the interesting part is what is going on. And finally, when I've observed the healer, we have studied for a number of patients, about 180 patients. And that's Muramatsu from Japan, who's remarkable. The most common quality he has is an absolute sense of confidence. And that's true of almost all the healers. They don't just believe, they know healing is possible.
So this would be something that would be good for us to do, whether we're going into the hospital or to an outpatient procedure, or we've simply come down with the flu, for us to trust the process and to be comfortable with the process and to trust that our bodies know what to do. The body has healed itself throughout history.
I would put it differently. Because when you're sick, it's very hard to have that belief yourself. When you have pain, it's hard to know that. However, that is really the role of the healer, the role of the physician, the nurse, in the genuine sense. In their role, their task is not to just sit at the computer, prescribe another prescription, which so often happens in the rush of time. It's to make that connectiveness so the patient has a deep trust. In that deep trust, their insecurity, their worries can fall away. And so then the medication, the treatment works so much better.
So a trust in the doctor, a trust in the medication or the procedure, a trust in the whole process.
Yes, and I think the role of the patient, and I would recommend that as a general, when you see a healthcare professional, whoever he or she is, if you do not trust them, whatever that means, search for another one.
When I was at the Simonton Cancer Center, I sat in on sessions that Dr. Simonton did with cancer patients. They would often ask him, I don't know if I should get surgery, radiation, I don't know which path I should take. He never told them which one. He always asked them, which one do you have the most faith in? Go with that one.
And I agree. And now the role of the healthcare professional can be to help guide that process, to give the benefits one or the other. But it's a very delicate dialogue. And that is the art, I call that's the art of healing, that's the art of medicine, that's the art of psychotherapy. And what Western medicine has so desperately lost is that, it used to be called TLC, tender loving care.
Right.
When patients come, they're frantic, it's insecure, they're worried. Remember, even if you can't do anything for the illness really, you can always, I think that is the real role, help remove and support that insecurity, that fear and panic. And in that process, you're already supporting the healing process, plus the medication, plus the surgery, whatever else you need to do.
And in fact, that produces medications made by the brain, the endogenous pharmacy. Correct. We have in us receptors for all these drugs that we're taking. Otherwise, they wouldn't work. Yes. So this state of mind that you're talking about actually makes it more likely that we will produce the ideal physiological environment for recovery.
And that is the part which I would want to really encourage healthcare to go back to.
Right. Yes.
And that is the one part that isn't billable.
Yeah.
You can bill procedures, but you cannot bill the tender loving care. And we know this even at night when a patient He's lying in a hospital frantic because at 2 o'clock at night, you worry, you get the demons coming up. There's almost nothing better than to have a nurse be there.
Yeah, right.
Have them hold your foot even, and just be able to talk to you, to as if you let the demons be transported to them. They can be,
right.
And then that peace is so healing. And instead, we're often just giving a sleeping medication.
Yes, right.
Or we're lying there with the blinking lights.
And the anxiety is such that the medication isn't going to work that well, and we'll need more medication and more medication, when in fact, a soothing touch may obviate the need for a medication.
Yes, and and there's lots of evidence for this. There's very interesting data out of Britain where they show just with sleeping medications that if a patient comes and you give a prescription because they can't sleep, have insomnia, if the doctor spends 10 minutes talking to the patient, the prescription rate goes down by 50%.
Yeah, isn't that amazing? Healthcare should be embracing this.
Yes, and I think, and that's a plea then, that insurance carriers need to pay for tender, loving care. It's much cheaper in the long term to spend time with the patient than to quickly do a treatment.
Cheaper in the long term and better for the patient and better for the healthcare provider.
Much better.
They're happier with their work. Thank you so much for joining me.
It's a pleasure.